Well, Shauna, it's a race of vaccines versus variants. The key in Ontario right now is getting enough shots into arms before variant cases potentially skyrocket. Ontario is receiving more than 500,000 doses this week. That's the biggest shipment it's getting yet. But many questions remain concerning how the most vulnerable will get them first.
I would say that we have a clear plan, but this is a mammoth undertaking.
But the opposition says the plan is anything but clear.
This should be made easy for people, not harder. It should be made easy and it should be able to be well understood. And that's certainly not what I sense at this point in time.
One area of confusion is around people with compromised health systems. On Friday, the government announced there were 3 groups that can start getting vaccinated in April. Highest risk, including people who have had organ transplants. High risk, including patients going through chemotherapy. And those at risk, for example, people with respiratory disease. It's not clear if they will have to prove they have underlying conditions. The health minister implied that will be left to the honor system.
In most cases, people they're honest.
However, a government spokesperson later clarified and said at-risk patients will likely be contacted by their doctor where they're getting treatment. In addition to over 300,000 Pfizer and Moderna vaccines coming this week, Ontario is also receiving 190,000 doses of the newly approved AstraZeneca vaccine. In a trial run, it will be sent to about 380 pharmacies in Toronto, Kingston, and Windsor for those who are 60 to 64 and must be used before April 2nd when the doses expire, a target the government believes it can easily meet. Pharmacies will use their own booking systems, but which pharmacies will be giving the vaccines has still not been released.
That information should be available shortly.
There is renewed urgency. The highly contagious variants now make up just over 30% of COVID cases and are expected to be dominant very soon.
We are seeing quite a significant increase in the number of COVID-19 cases that are screening positive for a variant of concern.
And on the very day Toronto and Peel had the stay-at-home order lifted, the Chief Medical Officer of Health warned people still need to be extra cautious.
We are in this phase where the model is saying we could be trending back up again.
Now, while the variant cases in Ontario make up 31% of all COVID cases, in Toronto, Dr. Davila says they make up about 40% of all cases. Remember, they are 56% more contagious.